I'm going to be doing the muscle energy technique for the horizontal abductors, but to start with, I want to use the Tyler technique to measure the posterior capsule tightness. So I'm just going to have my patient side lying. I'm then going to have her arm off the table. I want her into about 90 degrees of flexion. What I'm looking for is the elbow to the table distance. So what I'm going to do first is I'm just going to mobilize her scapula back, and that would be her distance of what she has for tightness of the posterior capsule. So that's where I would start with her, and then for the actual muscle energy technique, I'm going to have her roll over, and I'll use this side for you. So I'm going to bring her up into horizontal abduction, and what I'm going to have her do is just come into me for 5 to 10 seconds. Once she's done that, I want her to, with her other arm, bring her arm across, and we're going to apply a stretch of that posterior capsule, and this would be held for about 30 seconds. And then after we did this, we would then go into the muscle energy technique, and we could do this 3 to 5 times. And then again, bringing in that stretch. And then after I did that, then I would have her go into a sideline position again, and we would do the Tyler test. So again, measuring that posterior capsule, bringing her scapula back, and what I'm looking for is the distance between her elbow and the table. We want to make sure that that improves, so her elbow gets closer to the treatment table, which would then mean that she has an increase in range of motion. In the study, what they found is that a lot of throwers, when they have their arm above 90 degrees, they have really good external rotation movement, but they have lack of internal rotation movement. However, when you add the two together, they were equal as the contralateral, the non-throwing arm. So what this was meaning is that they had greater external rotation than they had internal rotation. So that is kind of where this study came from.